Vestibular migraine or Meniere's disease. This is a confusing question for a lot of doctors and patients. Meniere's disease presents with episodic attacks of vertigo, oftentimes lasting 2 to 4 hours, frequently associated with ringing in the ear, a sense of fullness in the ear. Vestibular migraines can manifest with very similar symptoms of spontaneous vertigo, oftentimes associated with ringing in the ears, fullness in the ears. However, if you delve deeper into the history, a clinician may often find a history of migraines when the individual was younger. They may be having severe headaches on and off, light sensitivity, sound sensitivity, but frequently the headaches are not always migraine as you would consider them in character. So they can be severe headaches, but they're not as bad as a typical migraine, which is super confusing for a lot of patients. In many ways, some doctors wish that they would have diagnosed this or named it a different condition because it leaves a lot of patients scratching their head. This leaves a lot of clinicians in a precarious position because they're trying to figure out if a person has Meniere's disease or vestibular migraines, and it's not always as clear-cut as one would think. And so doctors, doing what doctors do, like to go to the tests, and so the video nystagmography tests you all have heard me talk about before are one of the main tests that doctors use to differentiate the two conditions. There are also other sophisticated audiometric and audiologic evaluations like VEMPs and cervical VEMPs, vestibular evoked myogenic potentials, that's what it stands for. And with that testing, the literature was also not as definitive in these tests being able to differentiate Meniere's disease versus vestibular migraines. Now, a recent research article came out saying that the video head impulse test, which is where an individual wears goggles, the doctor will move their head quickly like that, and look for abnormalities in the eye movements, along with a caloric test, which is where we inject warm or cold air into the ear. They used to use water, and look for spontaneous eye movements and compare side to side. They are saying that this study out of the Netherlands, that these two features help to differentiate Meniere's versus vestibular migraines. Why am I bringing this up? A lot of you suffer with these chronic forms of vertigo that attack spontaneously, and I'm trying to bring you the most up-to-date information for you to have conversations with your doctor. None of this is medical advice. I'm Dr. Randall Gates, board-certified chiropractic neurologist, chiropractic physician from Gates Brain Health and Advanced Imaging Reno. I'm Dr. Randall Gates, board-certified chiropractic neurologist, chiropractic physician from Gates Brain Health and Advanced Imaging Reno. Check out my website, gatesbrainhealth.com, for more questions.